Welcome back. Thank you for tuning in to our next episode of the virtual Heart of the Business Conference. I'm Tom Jacobs, and along with my co-producers, Rita Hernandez-Figge, Jake Bartelt, and the rest of the team at MedHQ, we thank you for watching the virtual Heart of the Business Conference. We're joined by John Page, our host and discussion moderator, as well as today, Jack Diamond, our special guest. Jack is the director at Teladoc Health, and we welcome him to today's program. The purpose of the Heart of the Business Conference is to gather together people who are interested in topics around wellness and well-being. That is, well-being for individuals and also for companies and the organizations for which we all work. As part of our Heart of Business Conference series, we are collecting donations on behalf of the Metro Chicago Heart Walk. Thank you for your donations, and thank you for watching this episode of our conference. All proceeds collected from you, and we mean all proceeds collected, will be delivered directly to the Metro Chicago Heart Walk. This is an event created by the American Heart Association to attract community involvement and financial support for the AHA. In fact, MedHQ is also donating to the Heart Walk through 100% matching of your contributions, dollar for dollar. We're also fortunate to have many wonderful sponsors supporting our efforts and those of Metro Chicago Heart Walk. Today, I'd like to especially thank Blue Cross Blue Shield of Illinois for being today's sponsor. In today's episode, our host, John Page, along with Jack Diamond, will be discussing how virtual care continues to play a role across the healthcare spectrum. And in today's environment of the pandemic, we can all certainly appreciate that. So with all that said, John and Jack, please take it away.
We are going to talk today about telehealth and the growing field of medicine without actually going physically to the doctor. That's going to be exciting. With me today is Jack Diamond, and Jack is the director with Teladoc Health here in Chicago. Great facility, great growing company, Jack. You've got some great news in the past few weeks, so we are excited to hear about how we are going to be in a virtual world of healthcare. Welcome.
Yeah, thank you, John. I appreciate it. I thank you for taking the time to have me on today. I'm excited to talk about this topic. I'm going to be taking everyone through a journey and evolution of virtual care as a whole. We've been talking about some key components, innovations, changes, and I think this is a concept as a whole that is really here to stay in terms of changing the way that people are receiving access to care moving forward. So again, I appreciate you having me on today.
Bottle, right? The last few months, the genie's out of the bottle. I mean, I've been involved in telehealth for the last probably 30 years, and it's all come down to regulation and reimbursement and why we can't do things. And the technology has been there. You guys have been at the forefront, but in the last 3 or 4 months, regulation barriers have come down, and the reimbursement barriers have come down, and people have recognized all the great things that can happen with virtual healthcare. So I'm excited to hear that today. This is part of our series in Heart of the Business with MedHQ, and I know that you guys work a lot with the folks here in Chicago. So why don't I hand it over to you, and we'll get this started.
Awesome. Thank you. I appreciate it. So, to that, just to build on it, my name, again, Jack Diamond, Director of Broker Sales here at Teladoc Health. I've had the opportunity over the last, almost 5 years to work with several employers, brokers, on coming up with a customized strategy to implement virtual care within, their benefits plan and their offering to their employees. And, as John had alluded to, this whole concept of telemedicine virtual care has been around for quite some time. As long as people have been, having access to a phone, the ability to call their doctor, their kid's getting sick, they're calling their family friend who is a pediatrician, family doc. They've been connecting on that level. Once they started to commercialize it and build it into an industry to mass deliver it to throughout the healthcare system, that's when, the naysayers came out. That's when the red tape regulations started to file in. But to that point, John, I think you're exactly right on the level that, pre-COVID, the concept of telemedicine and virtual care was on an upward trajectory. I mean, that said, it was slower than that of what it is now. And I think a lot of that has to do with COVID. And there's no denying that, the current health emergency that we're facing has thrust the overall awareness and access and knowing and really shifted virtual care and telemedicine from a nice to have to really a need to have in today's benefit strategy. So
maybe one of the places
Yep.
we should start, Jack, is give me an overall frame when you're talking about telehealth and telemedicine and virtual care. Give me an overall view for maybe viewers that don't understand what the concept is.
Yeah, so the evolution into the virtual care concept I'm going to be talking about today started with the concept of telehealth, telemedicine. Connecting with your doctor telephonically or via video, depending on the technology level that you had, to help diagnose, treat, and potentially prescribe for those minor acute conditions. The reason why, the core reason why people were using telemedicine in the past were to address those common colds, sinus infections, your kid has a fever, things of that nature that, were more of a nuisance to take your individual child or yourself into the doctor for, that can be handled virtually. But now, innovations in technology, companies like Teladoc Health, others within the space, have expanded the reach that the individual consumer has in the virtual care space to meet a wider range of service needs. So now the cold and flu access and just having the ability to connect with doctors on that level is a way of the past. We're starting to see providers out there widening the scope into mental health, dermatology access, breaking down various treatment plans to address chronic condition management, second opinions for major cancer diagnosis, access to address back pain and stiffness, which, makes sense in today's day and age, given people are working from home, they got makeshift offices like myself. My back's been flaring up since March. Now I have the ability to go in and access that on a virtual level, something where I was somewhat limited in terms of where I was at previously. So this whole idea of the evolution of virtual care has broken down, socioeconomic barriers, geographical barriers, time restraints, depending on, where you're at with you're related to your work and your overall health plan, to provide access to people, to allow them to receive care on their own terms. And, we're very excited about where this industry will continue to progress, in the future.
It's exciting. I have a friend who has 38 licenses, 38 state licenses, able to practice. His full-time profession is a telehealth doc. And exciting career that, 10 years ago would not have been possible. And he gets patients from all over the place.
Yep. Yeah, and that's a good point too. That's the biggest thing is we're seeing more physicians, depending on what specialty they are in, gravitate towards this concept of delivering their care on a virtual level. So your friends, being licensed in those states, previously, if he just were to stick to his guns and be, have his own practice and service his community, that's fantastic, right? But now think of the actual reach he has available to him to be able to address, take care of members' needs in 38 states across the country. That's powerful in itself. And that's something why doctors are now able to share their expertise to the masses and service wider ranges of care, which is very exciting.
And it's kind of interesting because I know I worked in the past at University of Nebraska. We used to send docs out for a week out to the West Nebraska who had no physician, who had no access to healthcare. Now, anybody, anywhere, you could be living in Nowhereville, Wyoming, and have access to a specialist, right?
Yeah, and that's another good point. You're breaking down the primary care deserts that are out there. There's millions of Americans that are living in more rural parts of the country that don't have the access that they need to ensure that they are taking care of their preventative stuff, their chronic conditions, just their everyday cold and flu. And, that foregoment of care or that deferred care it can lead to more severe health conditions down the road. And virtual care is in a unique position to be able to deliver for those individuals and ensure that they are getting the care they need. So that's exactly right.
Excellent. Exciting times in healthcare.
Yep, absolutely. Well, to that, I will dive into it and get underway from the virtual care front. So, as we had just spoken about, this whole concept as virtual care is really been thrust into the forefront of strategy, and it's not just on the boots on the ground in terms of the primary care physicians, other family docs, MDs that are utilizing this. This is all the way from the top down. We're seeing a trickle down effect from major hospital systems. Health plans are migrating to a virtual first or virtual focus type of solution for their patient base. And what this is able to do is breaking down some of those risk barriers that a lot of the individual patients are afraid of currently, that are limiting them actually wanting to get in the car or take the time to go seek that various point of care. But on top of that, from the provider's perspective, is creating a scenario that is enabling them to reach a wider range of patients, but do so in a way that is also conducive to them staying healthy and continuing to be efficient on their day-to-day. And, this new, influx of focus on the virtual care front, has brought in several new adopters and first-time users to the table, which is exciting as more and more people become familiar with this concept and use it for that first time. It's just going to open the door to be able to incorporate additional services that will expand upon the clinical reach within an individual's life. So, you can imagine if you're an individual that wasn't aware of what telemedicine or virtual care was ahead of time, and now you use it for the first time because you're not feeling good and you have that fever or that cough, you get diagnosed, treated, you get prescribed, and in the time that you may have waited in the waiting room to go see your urgent care doc, your primary care physician, you're already on your way to get in to get a prescription. You've got a forever user at that point in time. And then from there, they're far more open to experiencing and utilizing additional services if they are struggling from a mental health condition, or they have something more severe with a chronic condition that they want to, ensure that their treatment plan is on the correct course of and path of action. So everything kind of synergistically lifts itself up one after the other in terms of utilization of the benefits when you get them to utilize that service for the first time. And
as
specific on the Teladoc.
As a consumer, how do I enter the system?
Yeah, so that's a good question. Yeah, it's on a few different levels. What we're seeing is a lot of the carrier plans out there are starting to incorporate telemedicine, virtual visits into their various offerings. So, that's kind of a blanket coverage on that level. We're also seeing large employer groups, small employer groups, all the way down to, a business owner might have 2 employees that's buying a virtual visit access for his or her employee population, all the way on up the spectrum. So at that level, generally it's employer or health plan driven that they're providing it to the individual consumers. There's definitely ways for, an individual business owner that might have a one-person shop to go out there and obtain these services as well. But there's several different access points that they can, get set up with a virtual type of visit. The most popular and generally the ones we see the most often are through the various carrier solutions.
So I'm going to find it in my benefits package, in my health plan. It'll tell me how I can access a virtual visit.
Yeah, absolutely. So in most cases, they'll be in there. And then, your employer, if they are incorporating a standalone type of solution that's sitting outside of the health plan, because that's also a very popular approach from various employers, then the individual consumer would receive that generally on behalf and being paid for by their employer as just another benefit within their package. Absolutely.
Excellent.
Yeah. So to that, what that's, again, creating is this situation to where, in the late March, really where COVID started to take off here in the States, we saw that huge influx of member population come in. And a big chunk, well over the majority of the visits that we were seeing during that time were from first-time users. Now, we got questions on that. What did that theme, what does that actually equate to? People thought that virtual care and telemedicine was the COVID service. Well, it's actually the complete opposite. So I think an important theme to keep in mind is that when it comes to this type of virtual care connectivity with doctors, well over 90% of the actual consultations have been related to non-COVID issues. You're still addressing the colds, the flus, the rashes. There's been a significant utilization spike in addressing mental health conditions, dermatological conditions, other points of care that are difficult to get to. They're somewhat labor intensive in terms of wait times, limited provider network, and virtual care is able to break down those barriers. And
I want to go to the doctor's office or the hospital to get care.
Right.
I think COVID is an issue.
Absolutely. So you got the fear factor in there, during this forced experiment, quote unquote, of COVID, forced experiment in the terms of virtual care, it being thrust into the forefront, there's no denying and there's no doubt that COVID had an impact in terms of the increase in population and the increase in total visit volume. But one would have thought that if it did fall along the lines of a COVID service, that the actual COVID-related conditions would be significantly higher. Specific to Teladoc, we're seeing upwards of 20,000 plus consultations a day, and 9 out of every 10 visits are non-COVID related. That's a vast, vast majority over, 20,000 life, consultation mark on a daily basis. So to that point, it's just speaking to the narrative that virtual care is here to stay. It's being viewed as a solution to address a wider range of clinical needs. And, hopefully when all this COVID is, behind us to an extent, or we're in whatever the new normal looks like, we'll be able to continue to hit the ground running, innovate, and expand upon the reach that individual members have. So good takeaway there, kind of an important part of the understanding of the evolution of this virtual care as well. But sticking with that theme, I think, again, it's important to hone in on the idea that virtual care is not just the concept of telemedicine anymore. It's not just addressing your basic general medical. It can be a vital part of any employer's benefit strategy. It can be a way to remedy some of the pain points individuals might feel from working at home now. I know, a lot of employers, a lot of employee populations, they have, setting up their own offices, they're in it for the long haul, or they're doing split days throughout the week. And that's creating a situation, again, as you kind of alluded to, people are afraid to go in and experience the traditional brick and mortar points of care. Implementing a virtual care solution can be that true virtual front door to be that starting point for any medical uncertainty that might come up. And these are just a few of the focus points that we're seeing here in the interim that employers are gravitating towards, that they're asking about, that their employees are seeing as significant value adds. The mental health side, which we'll go through some of the statistics here in a quick second, very important in today's day and age. You look at some of the environmental factors, economic factors that are coming into people's lives that were never present before. It's creating stress and anxiety, yet they don't have the access that they ultimately need to address those needs. And then from there, you expand into, chronic care management, or taking a second look at, the need to have a major surgery or a current treatment plan or prescription plan that you might be on for a recurring type of condition. So as you peel back the layers, each individual at one point during their healthcare journey is likely going to struggle at one of these aspects during their given lives. And as an employer, being prepared to deliver upon and have access points available and readily available for your employee population will ensure that you're hitting the mark and separating yourself, from a benefits strategy standpoint from, other employers within the space. So kind of a holistic view.
Some of these are wellness kinds of things too. That's interesting, because it isn't just an episodic, acute issue that I'm going to the doctor for. It's things that I should be to take care of my body and take care of myself.
Absolutely. Yeah, I mean, that's really where this is migrating towards is, you know, the longitudinal aspect of the service of the delivery of care. You know, being able to, let's say on the mental health side, you can have a recurring visit structure, an ongoing relationship with a psychiatrist or a various therapist that fits your personal needs, that learns everything about you. You know, it's not a one-time visit to where you're having to speak with someone time and time again and reestablish that relationship. If you can continue to have it ongoing, the overall effectiveness of delivering them care of that member at that point in time is going to be increased dramatically. And you're going to be able to start chipping away and dropping, you know, that major anxiety incident to, you know, a more mild, controllable state of mind for that individual. And that can only be done, to your point, of, you know, continuing ongoing basis and eliminating the episodic component of the offering.
That's interesting because I think a lot of people believe that you don't get the same doctor, that you have to take whoever is on duty that time. What you're telling me is I can see an ongoing doctor, just like having my own family physician on an ongoing basis, just virtually.
Yep. So there's you know, a new trend and then a new type of connectivity that's coming to the market. You know, it's been deemed the virtual primary care per se. And, you know, we've run it here specific to Teladoc, and I know there's other companies out there in the space that are working on rolling this out as well. But, you know, I myself am a user of it. You know, they've rolled it out to our employee population to test it out. And, you know, now I get to establish a relationship with a physician that's located in a different state I didn't know existed. She's highly credentialed. You know, I spent an hour and 20 minutes with her on the phone. You know, if you think about that in the traditional environment, you know, how many doctor's visits you could get in an hour and 20-minute span. You know, it's crazy. And she learned everything about me. She knows my entire medical history. She was able to order me labs, order me testing, you know, so I could have that information sent back to her. Everything's consolidated in one place. And then she's really able to deliver and drive my overall health outcomes in a more efficient fashion. So that's where this industry is going. You know, that's already available on the mental health side and some of the chronic care management, you know, with the recent, you know, merger on our end with Livongo and other chronic care management type companies. They have that ongoing treatment plan because it's essential in that type of you know, care condition environment. But to your point, virtual care is migrating in a direction where nobody thought it would ever reach, and it's doing so in a very effective and efficient fashion.
And they'll have access to my medical record and everything like that. That sounds great.
Absolutely. So they got everything in one place. You know, one of the key benefits of electronic medical records, you know, being able to be transferred and shared accordingly within providers. And, you know, having all that information is vital for physicians to be able to properly diagnose, treat, and prescribe. You know, if they're operating on a false premise or they're operating on a lack of information, they're not going to be able to deliver to the standard in which, you know, is clinically acceptable at that point in time. So that's why more data you can throw in front of them, the better you are as an individual patient and consumer to ensure you're receiving the care you need.
Absolutely. Sounds great.
Yeah, absolutely. So to that, I think it was also important to take a step back and look at, you know, what has happened in the environment, you know, because of COVID. You know, I think there's no denying that, you know, people, you know, as you know, we've talked about here, have foregone care altogether. There's been several deferred care moments that people have had surgeries canceled, things of that nature. So, you know, to that, pushing back care or eliminating care altogether creates, you know, a significant issue for members down the road in terms of their overall healthcare journey. So, you know, if I were to ask you, you know, based upon, you know, here in the United States, specific to COVID, how many individuals have deferred, you know, needed healthcare, you know, what would have been your first guess?
I would say 40 or 50% people were afraid to go into the hospital, into their doctor's office.
Yep. So early on, it was, you know, multiple studies came out. It was around 1 in 3 individuals. So it was right around that 31%. So I think as more and more people and as COVID continued to linger, you know, that number has continued to go up because more and more people are just saying, listen, I'm just not going to risk it until something's available, until there might be a vaccine or until something happens, right? So the individual consumer, again, is afraid. But, when you look at that, aside from just the fear factor of it, you look at some of the factors that, come into play that are already limiting some of the access that individuals had pre-COVID. There might not be as many providers within their given network or their given area. If they are in a rural setting. To that point, there's been several physician offices, doctors across the country that have had to shut down shop, or, they've gone to more heavily populated areas to administer and provide their care, eliminating another doctor for some individuals that are in the quote unquote primary care desert. So you look at those people, they don't have the access that they need. You look at the emerging economic hardship and the ongoing economic hardship. There was already socioeconomic discrepancies in the healthcare system and discrimination that limited some people from being able to go out and receive the care that they need altogether. As more and more people have jumped on unemployment, the financial hardship has continued to mount up. People are having to spend their dollars on other things rather than addressing a medical condition. And then from there, those people that were scheduled, elective surgeries across the board, a wide majority of them have been canceled or postponed altogether. And a lot of times when you look at the postponement of said surgeries, you can, keep it specific to the orthopedic. A lot of those may or may not be, elective in one way or another. There could be ways for physical therapy treatment or other alternative means of, providing care. But, 60% of those individuals who were not high cost 12 months ago are high cost individuals today. And there's factors that can contribute to that. Again, foregoing care, they didn't get their preventative checkup, they haven't gone to the doctor in X amount of years because of, various factors that might come into play. So virtual care, again, is uniquely positioned to ensure those individuals have a starting point in some way, shape, or form. If they're having an individual physician, a specialist point them in the right direction, then ultimately that's going to, add up over time and allow them to hopefully eliminate some of those more chronic conditions that might come later on in their life. But on top of that, a lot of negative has come from COVID, obviously specific to the traditional environment, but there has been, a slight positive in terms of it's allowing individual patients to take a step back and reassess where they're at medically. A big issue here in the United States, and there's several studies that suggest this, but medical misdiagnosis and mistreatment is one of the leading causes of death here in this country, which is staggering to think about, given the advancements that we have in medicine. But the fact of the matter is physicians generally have the odds stacked against them. It's even more so now in terms of the number of patients they're dealing with, the limited time that they have. They might be not operating on all of the past medical history. As we just spoken to, if doctors don't have your medical records, they don't know what happened to you in the past that might be pertinent to a future diagnosis, they might get it wrong. And, doctors are human. They do make mistakes. So it happens. And what this has opened up the door for is those individuals that maybe didn't want to get a second opinion before, or took the path of listening to their doctor right out of the gates, which, in any case, you speak to any doctor, they advise go get a second opinion.
Correct.
So to that, there's services out there, there's sources out there that these individuals can now go and utilize on a virtual care level to have their past records reviewed, have those ultrasounds, those MRIs, those x-rays reviewed and re-examined to, maybe find a better treatment plan. If that surgery that you had is so dire, one thing, surgeons like to do, they like to conduct surgery, not saying, not saying every individual surgeon is just going to push people to surgery. The vast majority of them obviously go about the right way with their patients, but some surgeries are just unnecessary. Maybe that individual just didn't know. So having resources out there that provide more information, more transparency on their options is critical in ensuring that those individuals are meeting their needs at that point in time. So, speaking to that again, additional roles, providing the expert guidance, the access. And I think, breaking it all down, the most important thing to the end, patient, the consumer, is, the increase in the overall confidence that, they know that the decision they're making, because they've had multiple eyes looking at it, they've had physicians, across the board examine it, telling them what they should be doing. And they know that in their heart of hearts, they're doing what's best for them at that point in time medically, which, is half the battle in some of those cases on more of those critical, complex surgeries or conditions.
Absolutely.
So that's really the framework. We can start peeling it back again into deeper layers. And, I kind of mentioned, we got a handful of slides here, and I think, closing up with the mental health is important. This current environment has expanded the virtual care capabilities with mental health, significantly, but it's still just scratching the surface in terms of breaking through the social stigma, breaking through, the overall awareness and understanding that virtual care can deliver on these more specialty types of needs. So again, another fun question, if you had to guess what percentage, of individual employees, and there's been a few studies that have kind of fallen in the same, percentage point, feel as though their overall mental health has been suffering due to COVID-19.
I saw a study today that said it was almost 70%. So it's got to be one of the highest numbers there, because as this drags on, people get more and more stressed.
That's perfect, because these numbers are from about a month and a half ago. So that makes sense. That number has continued to go. The study that we conducted internally, we brought in a third party to help, found that around 47% of respondents found that COVID-19 was having a negative impact on their overall mental health, which, that's a significant figure. When you look at it, the overall impact on the individual's lives is apparent in terms of, how many are actually affected, the age groups. Generally speaking, what we see within an employee population is the younger generations are struggling with mental health conditions, or at least they're more open to talking about it than that of older generations. I think there is a generational gap there.
They don't have that stigma attached to it as much as we did in my generation. I would never talk to a psychiatrist, right? Because I'm not trained. Yeah.
Right. That was the thing. Yep. And that's exactly the thing. And that's the social stigma, unfortunately, that, your generation, unknowingly put on to, my generation, the younger individuals within the employee population that are coming up are, far more open to it, because I think we've started to break through that stigma to an extent. That said, there's still a long way to go. Based upon this study, the alarming figure that I see that jumps out to me, where I think, there's a fantastic opportunity for employers to take advantage of these circumstances, is the fact that only 9% of the respondents have reached out to their manager or their employer to address and talk about their mental health concerns. It makes sense when you look at it, though.
You're absolutely correct. It's one of those, we don't want to talk about it in our families, much less, to your boss, because you think there's some issue down the road that will come up. You won't get that promotion, or you won't get that, that raise, simply because they think John's unstable.
Right. Absolutely. And that's one of the biggest issues. And that's where, as an employer, when you're having those discussions, you can normalize that for the end user, for the employee. When you do normalize that and you take the charge as the business owner or the CEO or the key communicator within a company, you're one of the main leaders, just saying it's okay. It is okay to be suffering, especially during this time. When you're, pre-COVID, there was still, a significant number of individuals that were struggling with mental health conditions. And the second you start to normalize that conversation and allow and create an opportunity for individuals to feel as though they're in a safe zone, that's where you're really going to start to be able to chip away and ensure that people are receiving the assistance that they need. But until then, if employers are still, focusing their benefit strategy on the physical, in the past, that's what the benefit strategies were all about. My parents' plans, what they wanted? They wanted to make sure that we had as low of a copay as possible, They didn't want a deductible plan. We're taking our kids in. They wanted to control their costs to an extent. They wanted to know how much they were spending, just in case myself or one of my two brothers, got in a fight or hurt one another, or did something to where we broke an arm. Right. So little stuff like that. They wanted to control the physical. That's what the benefit package were all about. In some of the older generation's main focus. But, as these new generations come into the workforce, employers need to adapt, and they need to adjust their overall strategy to meet the members where they are. You look at the largest population within the workforce today is millennials. Well, millennials and Generation Z, younger generations, one thing that we are, sophisticated at is technology. And one thing that we use more than any other population that, a lot of people give us some grief for is we're staring at our smartphones 24/7, 365, right?
I have a 24-year-old, I understand.
So, you're probably smacking him at dinner, telling him to get off his phone. That's just, what our generation is all about. And if you can connect with individuals on that level, then you've got them. You're going to create and start to generate that behavior change. And it's easy to do it on the mental health side because younger generations are more open to actually initiating and having those conversations with a psychiatrist, therapist, psychologist, because it isn't, to your point, viewed as, I don't want anyone to think something's wrong with me. It's, hey, I need help. And if we can get it to that point, then we're moving in the right direction.
And I think you called it normalizing. It is normalizing. Just like you don't want to wait until you have an acute issue physically. If you're having a little stress, talking to somebody about it may short circuit that from becoming some full-blown issue. And I think there's a lot of people stressed under pressure right now. Everybody is feeling the pressure. Even, no matter how easygoing you are, this has been a difficult 5 months.
No, absolutely. And it's been a difficult 5 months, and it's absolutely, kind of expanded upon some of the pain points that individuals are feeling. And we'll go through some of those here in a quick second. But, this mental health, pandemic that we're also facing, within our workforce and within our population in the United States, it's been around for quite some time. These are figures from a study that we conducted back in 2019. The recent study from the statistics on the last slide were, from about a month ago, kind of helping to support and see where the ongoing trend is. But, again, I think the number in the 82% is, it speaks volumes. The vast majority were afraid or uncertain about confiding in a manager about their mental health condition. You look at the direct correlation there is with mental health conditions and being in the workforce, lack of productivity, you're taking days off because your anxiety or stress, depression, you're cutting into, the absenteeism component, which costs employers money. So there's a trickle-down effect when an individual goes untreated, both on the individual level for more chronic conditions, but then financially for the employer as well. So that's where you can, if you invest in some type of solution and access, you can see a definite ROI as an employer, just being able to ensure that access is there. Absolutely.
That's fantastic.
Yep. And then to your point, some of the changes in today's world, this is a completely different environment than that of, 5 months ago. The overall idea of juggling family and home life, kids are going back to school, here, I'm located in Arizona. I've spoken with a handful of colleagues that, have younger kids. And, one of them expressed, how difficult this moment is. He has, 3 young children that are all starting school. One's in 6th grade, there's a 4th grader, and there's a 1st grader. So, he's got a wide range of, children that he needs to make sure are getting pointed in the right direction, and he's administering all of that teaching, online. Well, at the same time, he also has a job. His wife has a job. There's other components in their day-to-day that they need to take advantage of or take care of. And it's creating, more stress and anxiety that they would have never thought about, 5-6 months ago. And that increase in stress and anxiety is just continuing to increase the likelihood of a major mental health condition, coming up in that individual's life. But on and, kind of so on and so forth. When you look at the other components, you look at, people are losing family members now. They're being isolated from family members. There's individuals that are losing loved ones due to COVID-19, and they're not being able to properly say goodbye or cope in an appropriate manner. That's going to take a toll on any individual, regardless of who you are or how mentally stable you might have thought you were. There's a direct correlation between, isolation, keeping people at home, and then the fear of the economic situation, lack of job market, not being able to hold a job, and increases in anxiety, depression, so on and so forth. And what we're seeing is when these conditions are left untreated, if individual employees don't have access to the services that they need, or they're not aware, they're not getting the care that they need, there's long-lasting effects that are going to come into play. And if these problems don't go untreated, the slide that we had seen, earlier, 60% of high-cost, individuals were not high-cost, 12 months ago. Well, we're kind of in the starting point of that bubble. 12 months from now, it's going to be interesting to see what happens, what those, that claims data looks like, what that, individual's medical journey looks like, to where, they might be deemed and seen as an extremely healthy individual now, but, 12 to 18 months down the road from now, they might be suffering from some type of major chronic condition. You look at chronic pain, heart disease, hypertension, obesity. If people are struggling from depression, anxiety, increases in substance abuse, which can lead to, further trickle-down effects. So it really goes on and on and on. And that's why, I say employers are in an extremely unique position to be able to provide an offering that, A, provides an ROI for them as an employer, which is, key, but more importantly, it's servicing a significant need for their employee population to ensure that, those individuals are being taken care of both physically and then mentally, because everything's correlated and directly related to one another. And what we're seeing is when an employee a type of offering and it is utilized, the awareness is there. I mean, you're going to chip away and you're going to limit those, more, higher to moderate to severe types of anxiety or depression incidences. And if you can control those, you're going to put that individual employee in a much better state. Probably going to make them more productive at work, going to make them more productive at home with their family, and then so on and so forth. So if we can chip away with the depression and anxiety now, higher likelihood of eliminating any further conditions down the road. On top of that, you look at incidences with major depression. Those are big cost drivers towards the plan, towards an individual. If you're looking at major anxiety attacks or things of that nature, hospitalizations for mental health conditions, it's not cheap. And the individual has to pay for, the employer's paying for, depending on the plan. Especially now, people don't want to go to the hospital for, a mental health episode, altogether. So again, if they have someone they can talk to, they have that access point. If we can eliminate this altogether, then, early access is going to be the preferred way to go, and it's going to service a fantastic need at that level. So that said, I know we're at the 45-minute mark, kind of going through, hopefully touched on several main points, but figured I'd kick it back to you as, that was the extent of my presentation for the day.
Well, I think the good news is that we learned a lot about telehealth, what virtual care is, and even better news, employees have it available to them now. What they need to do is just get the contact number from their employee portal.
Yep.
And there's an app that they can download too. So, I mean, the information is there, the access is there. We have to get people using it and seeing it as a wellness benefit as much as it is a care benefit.
Yeah, absolutely. I think it's the more they view it as a holistic starting point, the more likely they are to come back and utilize the service for more than just needing to talk to a doctor for a basic cold or a flu or something of that nature. So, that's important. for people to understand that, it truly is, and it can be a solution that, can address any medical uncertainty. And if it can at that time, it's something that can be a starting point to point you in the right direction to assure that you receive the care that you need.
Well, it's great. I know that, I started in the 70s with quote unquote telehealth, meaning that we actually had phone calls, if you remember, the actual dial telephone out to diabetes patients to make sure they were treating themselves. And it has evolved to the point where you can see a specialist online. I look today and I can get a pulse oximeter for $12 online delivered to my house. I can get my own blood pressure cuff. My watch will do an EKG tracing. It's a single line, but it at least tells me if there's something weird happening. Technology is available, and more we can incorporate these into those kinds of visits where the doctor has access to it remotely, even if I live in Nowhereville, Wyoming. Yep,
absolutely. I think that's an important point. The technology's there. It's all about getting those various technologies. There's the smart thermometers. There's, I got the watch on, the EKG as well, linking that in. There are, the heart rate monitors that can be sent at home, and, so docs can get your vitals, important component as well. So, the technology's there. It's all about getting that message out, delivering it to the end consumer, changing the way that they're accessing healthcare, and ensuring that, we're meeting the clinical standards and clinical quality that employees need to ensure that they're getting the access that they want. So it's an exciting time. The convenience. Yep. Yeah.
Factor. Yeah. I can sit in my house, have a 10-minute visit without it taking half a day for that 10-minute visit. I don't incorporate an hour and a half travel each way, a $40, a $40 parking fee. The aggravation of going down and then having your cardiologist tell you, boy, your blood pressure is up. Well, yeah, I had to drive the Eisenhower today, right? So there you go.
Yep. A 10-minute visit when you're sick is far more convenient on your own couch than it is in a waiting room of a doctor's office. I'll give you that.
The worst place to be, the waiting room, which, by the way, is going away, right? In the last 5 months, nobody has a waiting room anymore. You sit in your car and they, just like your pizza, they tell you your pizza's ready, come in and get it. Your doctor will see you now, come in and get it.
Yep. Yeah. It's an interesting shift. I think it's going to, be interesting to see what this new normal looks like in terms of the traditional brick and mortar delivery, if they continue on with that trend. I think what's interesting to see is, the early adopters to the virtual care message, generally the younger population that's, a little more tech savvy, we're in the know, maybe didn't have a primary care physician. Myself, I'm a millennial. I don't have a traditional PCP. I'm a little bit of an outlier. I've been with Teladoc for quite some time, so I've just used that, access point to receive the care I need. But I go to my dad's, PCP for my once a year checkup. My dad, for as much as I'm pushing to talk to him, he, it's just like, well, I got my doctor in person. I go, well, it's a little different. But now he's calling me, hey, Jack, tell me all about this. What is this? And so now he's diving into it, right? So, there's been a paradigm shift in terms of, generations that were once not behind the eight ball. That's not the right way. Just a little more stubborn in terms of receiving their access to care are now truly viewing virtual care as a viable solution because of what you said, the convenience and the fact that they don't have to go travel and subject themselves to any of the dangers that might be out there.
Well, I'm excited about it because as I grow older, and I don't want to live like my parents lived, where their whole week was defined by what day they were going to the doctor and did they have to go down the mountain to, it was a full week of planning for one doctor visit. It's like, no, I want to live my life. And if I have to see a doctor, great, 10-minute visit. And I can do it from Hawaii, right?
You can do it from anywhere. You can do it on the beach. So I'm fairly confident that those days are over. No more scheduling your whole week around one 20-minute doctor's visit. Virtual care's got you covered.
All right, Jack. Hey, you got me, man. I appreciate it. It has been great talking with you. Jack Diamond, Teladoc Health. here in Chicago. And Jack, you are even remote working for Teladoc, right? So you're in Arizona.
That's right. I'm in Arizona, slowly cooking away out here, but we're making do.
Thanks for joining us on Heart of the Business with MedHQ. I appreciate it. I'm John Page. Thank you, Jack Diamond. Be well, man. Stay safe.
Thank you, John. Appreciate it.
Take care.